My name is Robert Popovian. I am a pharmacist, and I also have a master's degree in pharmaceutical economics and policy. So most of my work is in the policy healthcare field. And Global Healthy Living Foundation is a patient organization, as the name sounds. It's a global patient organization based in Upper Nyack, New York, and but we do work in Canada, in Japan, in ex-US markets as well. And it's truly a patient advocacy group. My role within GHLF is that I joined them about 2 years ago, and I started their economic and policy research division. This division is intended to look into economic and policy issues that impact patients' lives and access to healthcare services. Well, I think you have to go back and look at our original study that came out last year, which was published in the Journal of American Pharmacists Association. In that study, we looked at access to physician practices who immunize. These are internal medicine, primary care, and family practice physicians locations versus pharmacies in low-income communities. And the study that we did, and it unequivocally showed, the data showed that patients in low-income communities have better access to pharmacies than to physician offices for immunization purposes. So this was more of a follow-up study to see what has happened post-pandemic, because remember, what happened during the pandemic early, especially the first few months of the pandemic, everything was shut down, everything went virtual. Almost all of the care provided, especially on the primary care level. So if a patient in the community really wanted to see a healthcare professional, the pharmacy and the pharmacist was the only access they had, unless they wanted to go to an emergency room or to go to a hospital, which nobody did. So what we wanted to look at with this current study that we partnered up with IQVIA Human Data Sciences was to look at what happened post-pandemic with regards to immunization. And unequivocally, more patients, more adults especially, chose to go to a pharmacy for their adult vaccination than prior to the pandemic. The positive nature is that there's the PrEP Act and all of the declarations that sort of harmonized and expanded the authority of the pharmacists to immunize. Specifically, it authorized pharmacists to immunize all of the COVID vaccines, as well as for pharmacists to provide ACIP recommended childhood vaccines up to the age of 3. So if the PrEP Act is not codified in state law, as you know, pharmacy practice, medical practice, nursing practice is all governed by state laws, and the PrEP Act is a federal declaration. And if that's not codified within state law, after PrEP Act goes away and the declarations go away, then the laws revert back to what they were prior to. And as a society, as a community, as a country, I don't think we want to take access away from patients. We want to always improve access. And this will be the case where if we don't codify this law in the state, by the states, and some states have done it, I have to say that, but about 20 some odd states have not, we will be reverting back to what it was. And it's unfortunate because we will be taking access away from patients. And as I mentioned, from our previous study, patients who are in low-income communities have better access to pharmacies, and minority patients, the racial and ethnic minorities, are overrepresented in those low-income communities. So in effect, we're going to negatively affect the equity issue that we're all, as healthcare professionals and communities, are trying to address. Implications are, when you give adult patients a choice to get their vaccination at a physician's office or a pharmacy, overwhelmingly, after the second quarter of 2021, that pharmacy became the main hub for the COVID vaccine, right? Because remember, in the first quarter, when the vaccine was available, we were doing these mass immunization sites, and they eventually went away. And when they went away after second quarter, really pharmacy became the primary hub. And without a doubt, post 2021 second quarter, almost 80 to 90% of all adult immunization of all vaccines that are preferred for adults were provided at the pharmacy. So truly what the implications are that patients have chosen to go there. It's more accessible. It's especially accessible for more low-income communities and of patients of racial and ethnic minorities. And we need to keep that access open because it's going to help patients get what I believe as an economist, the most cost beneficial intervention we have in healthcare, which is vaccines.